Hello and welcome to The Explainer. Today, we are jumping headfirst into the world of diabetes care devices. As pharmacists, you know we're on the front lines, helping our patients sort through this constantly changing tech. So, this explainer is all about breaking down the latest in monitoring and insulin delivery, giving you the solid insights you need to really guide your patients. Okay, let's get right into it.
Before we get into a single gadget, let's start with the North Star, the big goal. For most of our adult patients with type 1 or type 2, this is the number we're all shooting for, an HbA1c of 7% or less. Pretty much everything we do, from therapy choices to patient coaching, is driven by this one target.
All right, so here's our game plan. We'll kick things off with the goals of glycemic control, just to set the stage. Then, we'll get into the nitty-gritty of traditional capillary blood glucose monitoring. After that, we'll explore the really exciting world of CGMs, cover the devices for getting insulin in, and wrap it all up by looking at our vital role in this whole new world of data.
Okay, Section 1, establishing those clinical targets. Helping patients understand the why behind all the numbers it's absolutely everything. It's what turns the chore of testing their blood sugar into a purposeful act of managing their own health.
So while that 7% is our go-to target, it's really not a one-size-fits-all deal, is it? Look at the nuance here. For pregnant patients, the targets are way tighter, and for good reason. It's all about the health of the baby. And this isn't about rigid rules. The key is to individualize. You might have a frail elderly patient where a goal of 8.5% is perfectly reasonable, but then a newly diagnosed, otherwise healthy patient might be aiming for under 6.5% if they can get there safely.
And this chart is such a great tool for us. It basically translates that long-term A1C value into the day-to-day numbers our patients are actually seeing on their meter. So an A1C of 7% works out to an average glucose of about 8.6. But here's the really crucial counseling point. The closer a patient gets to that 7% goal, the more their after-meal glucose spikes start to really influence that overall average.
All right, let's move on to the tool that's been the foundation of diabetes care for decades. I'm talking about capillary blood glucose monitoring. The classic finger prick test.
So what is a CBG meter really doing? Well, think of it like taking a photo. It's a perfect, accurate snapshot of a patient's blood glucose at that one specific moment in time. But what's missing? The story. It tells you nothing about which way that number is heading. Is it stable? Is it skyrocketing up? Is it plummeting down? You just don't know. It's a single, still frame in a much, much longer movie. And this is really where we pharmacists can shine. When a patient needs a new meter, it's not just about what's cheapest or newest. We can walk them through these factors. Does your patient have arthritis or poor dexterity? Then a meter with big test strips or maybe a preloaded cartridge is going to be a lifesaver. What about someone with vision problems? A big, bright screen or a meter that literally speaks the result to them? Well, that's a game changer for adherence. So this leads us to the question we all get at the pharmacy counter probably every single day. A patient comes in frustrated and says, "My meter is giving me weird readings." What's usually going on? And 9 times out of 10, it's one of these culprits. You've got your simple user errors, of course, but the big one is often the strips themselves, expired or stored in a steamy bathroom where they can get ruined. Not getting a big enough blood sample is another classic. And of course, the one we really need to watch out for is medication interference. It's always good to remember that acetaminophen can falsely increase a glucose reading, while high-dose vitamin C can kind of make it go haywire.
And hey, let's not forget the other half of the test, the lancing device. It's so easy for patients to just use the same lancet forever. A quick 4-step demo can make a world of difference. You know the drill. Clean the spot, show them how to load a fresh lancet, and this is a big one, how to adjust the depth setting. Then really drive home the importance of rotating sites. Their fingertips will thank you. And finally, show them that little ejector button. So much better than wrestling a used lancet out by hand.
Okay, so we've talked about taking that single photo. Now let's pivot to the full-length feature film. Let's talk about the evolving world of continuous glucose monitoring, or CGM.
This table really lays out the core differences beautifully. First off, CGM isn't measuring blood, it's measuring glucose in the interstitial fluid right under the skin. Instead of strips and lancets, you've got a sensor that stays on for 10 to 14 days. And a huge counseling point is that warm-up period after they first apply a new one. But honestly, the real game changer here, the ability to set alerts for low blood sugar. That is a massive safety net. So, this slide gets to the heart of it.
It's about shifting from being reactive to being proactive. A finger prick that says your blood sugar is 5.5 is just a number. But a CGM that says you're at 5.5 with a double arrow pointing straight down, that tells a completely different story. It tells the patient, hey, you need to do something right now before you have a serious low. That little trend arrow turns a piece of data into life-saving intelligence.
And the clinical evidence for these things is just solid. For our patients on insulin, CGMs have been proven to not only improve their A1C, but maybe more importantly, they increase the patient's time in range. They slash the frequency and length of hypoglycemic events, especially those scary lows that happen overnight, and all of that just adds up to a huge improvement in their quality of life.
But, it's still technology, and technology can have glitches. So, what are the common fires that we as pharmacists are going to have to help our patients put out?
Okay, first, those reading discrepancies. Our go-to advice has to be, if the number doesn't match how you feel, trust your body and do a finger prick. Second, data loss. For the real-time CGMs, it's usually just a Bluetooth range issue. For the ones you have to scan, you've got to remind them to scan at least every 8 hours, otherwise they get gaps in their data. And finally, adhesion, getting that sensor to stay on. Proper site prep is key, and we can be heroes by recommending products like adhesive wipes or overpatches.
All right, so we've spent a lot of time on monitoring the glucose. Let's switch gears and talk about the devices our patients are using to actually deliver their insulin.
Now, insulin pumps can be absolutely life-changing. That steady, consistent drip of basal insulin is just so much better at mimicking what the pancreas does than long-acting injections are. Plus, the flexibility it gives patients around meals is incredible. But we have to be really honest about the disadvantages. The cost up front is a big one. And there is always a risk of malfunction. A blocked infusion set, a dead battery, and when things go wrong, they can go wrong fast.
And this right here, this is probably the single most critical counseling point for any pump user. When the insulin delivery stops from a pump, it is not a minor inconvenience. It can lead to diabetic ketoacidosis, DKA, within just a few hours. Every single person on a pump must have a backup plan. That means having insulin pens or syringes available, and they have to know the signs and symptoms of DKA cold.
So this brings us to our final section, and it's really all about us. With all this amazing and complex technology, our role is changing right before our eyes. We're evolving from simply dispensing products to helping patients actually understand and act on the mountains of data these devices generate. We are becoming data coaches. Think of this as your diabetes pit stop checklist. It's a fantastic tool to make sure we're providing comprehensive care. Every time we fill a diabetes prescription, we should be running through this list in our heads. Hey, how are you doing on test strips? Do you have glucose tablets for lows? Do you have a glucagon rescue kit, and does your family know how to use it? Need any of those sticky patches for your sensor? This is what holistic care looks like, and it starts right at our counter.
So I'm going to leave you with this final thought. We've gone from a world where patients had maybe 2 or 3 data points a day to a world where they have a constant streaming river of information, and the technology is only going to get more advanced. So the crucial question for our profession is this: how are we going to adapt our practice, not just to hand out these devices, but to become the true data interpreters that our patients so desperately need?